Of course, Mr. Bond. My demands are quite simple. Oh, I'm sorry, wrong video. Hi, everybody. My name is Joel Lowsky. I'm Aspen Dental Management's Director of Academic and Industry Relations. I'll be moderating the Ask Me Anything session at 5. Throw any question you can think about us. We're looking forward to answering it. Thank you. Have a nice day.
Well, hi, everybody. Thank you for joining us tonight. I'm Joel Lowsky. I'm the moderator. I'm here with Dr. Kimberly Haynes-Reese, Dr. Alex Williams, and Dr. Ari Choi. And we are your Ask Me Anything panel tonight for general dentistry. Let me say thanks for taking the time to join us on a Thursday night, and we're really excited to get going. We'll get right into it. I'm sort of mission control on these things. I've got a bunch of monitors up here, and I'll be handling the questions as they come in. I'll try to keep the questions thematically linked however I can, but the nature of these is such that we encourage you to just throw whatever's on your mind at us. We like to think that the audience dictates the contents of these, so just submit your questions using that QR code that you should be seeing right now. And I'm going to start with a couple of questions that came in when you guys registered, so we're going to dive right into it. All right, how many patients do I see as a new associate? Ari, why don't you take that one?
When I first started off, I probably saw, I want to say, between 5 to 10 patients. And then it kind of escalated to me being at another office, a high volume office. And at that point, it was between 20 to 30.
All right. Dr. Williams, I'm going to turn the question a little bit. When you have a new associate, how many patients are they handling?
Yeah, so I think that is different practice owner to practice owner. For me, whenever I bring an associate in, obviously there is a time where we're trying to just kind of get them acclimated to the culture, the environment, the patient flow, I think is really important. So obviously I want to make sure that they are comfortable with where we're at. So the first, 4 to 8 weeks, they're going to be working alongside me or another mentor doctor where they're going to get worked in slowly. But after a while, they should be seeing at least 1 or 2, production cases in the morning and a couple production cases in the afternoon until they get their speed up. And then we're going to kind of tailor it to specifically at, each individual associate.
Thanks. Kim, anything you want to add on that?
Sorry, I had myself muted. No, actually, I think they both pretty much nailed it. No response.
Okay, thank you. So here's another one, similarly thematically linked as promised. As a dental student who is graduating next year, COVID has truly hit dental students hard in the experience area. Do practice owners expect newly graduated dentists to be immediately quick and treatment plan perfectly once they're hired? Alex, this one seems to have tickled you just right. Go ahead.
Well, it's funny because we were just actually talking about this last week with a few of my family members who are also dentists and some of my partners. But in actuality, I never expect anybody coming out of dental school to be able to handle what we handle on a day-to-day basis, regardless if they experience COVID or not. So, I don't expect them to be prepared to handle any of the flow that we deal with as dentists who've been out for a longer period of time. But yeah, I think that it is going to hurt them a little bit. Obviously, I do expect that. But that's the beauty of this scenario. It's allowing us to work directly with these younger doctors and help guide them, make them feel comfortable. Some of these colleges out there, UCLA is even adopting a program where they're going to allow, dentists like myself to be able to sign up as a provider and an actual, educator and be able to work with these as residencies and things like that. And those are great ideas because now we're getting into this different environment where associates are going to need a little bit more of that time. And I think that that's what we can provide here at Aspen.
Thanks, Alex. Kim, what are your thoughts on that? Dentists fresh out of school and the impact that COVID had on their clinical training.
Honestly, I don't believe anyone is really should I say, ready per se for their first job. So I think mentorship is really important. And I believe that, myself and a lot of the other practice owners and mentor doctors are able to do is work alongside new doctors, not just helping them clinically, but also helping them understand what their day is going to be like. And then just whatever growth, career goals, and things like that that they have in the future. So are you prepared? I understand COVID. Yes, it's been hard on everyone, but I mean, we'll hold your hand through it. And I think that's what's most important.
Thank you. How would you describe a routine day for an associate dentist at Aspen? And let's call this maybe 4 months in. So beyond the initial shock of being a first-time dentist or a first-time associate at Aspen. So what's a regular day look like? Ari, why don't you start with that one?
Okay. Well, I always look at the schedule the day before or the night before to see what it's going to be like. I'll lay the framework, and then the next morning, a few new patients will usually be added. So I'll take a look at that, and then I'll talk with my MCD and kind of talk about a game plan on who's going to see who. But usually we'll tackle on a new patient, and then whoever the MCD is will do the production, and we'll switch back and forth so the flow's right. And then whenever one of us gets stuck in production, we'll go ahead and hop into the other rooms if they need us in overflow. And then we'll have our lunch and then proceed with the rest of the day. But if you have another doctor with you, it's always really easy to get the flow going right. Right now, I'm in an office by myself because we just opened up a few months ago. So it's a little harder, and our office is getting really busy. But by doing that beforehand as an associate, I feel like it's really allowed me to be more independent and be able to tackle on a brand new office as a first year graduate out of dental school.
Ari, you said it several times. What is an MCD?
Oh, managing clinical director, which AKA means lead dentist.
Thank you. Kim, would you like to add anything on that? Sort of a typical day for an associate?
I believe she pretty much covered everything. I think the only thing I would add would have to do that they are working generally with the assistance of a managing clinical director, so they wouldn't be by themselves. So if there is generally more of the load, the patient load, or should I say, the associate really focuses more on their column, and the actual operations and things of that nature more or less in the clinic, that's more or less handled by the managing clinical director.
Great, thank you. We're going in a bit of a different direction. Folks seem to, there's a few questions of this nature, so I think folks are looking for stories. We'll start with you, Alex. What are some of the hardest patient encounters you've had, and how did you deal with the situation?
Oh man, that's a tough one. Obviously, I think that we all can agree that a lot of our toughest patients are going to be denture-related, cases. You get patients who just come in with these really out there expectations, and really that's what it is. It's about laying down the expectations with those patients. But you're going to have people who are going to come in disgruntled. We are. As far as clinical autonomy, we're very similar to private practice, but in a very different way. We see a lot of different demographics within our patient base. And so we do see there are going to be times when you're going to deal with some very disgruntled patients. And you do have to sit back and just listen. Guys, it's all about listening. And if I could teach any of my associates anything, it's just to listen to people, hear your patients, tell them you're sorry, just say, look, I'm going to make it better. I'm here to help you. And usually when you do that, you've disarmed them, and they usually turn it around.
Great. Kim, any difficult patient encounter stories you'd like to share?
I mean, we're human, right? So obviously, it's about human interaction, right? And so ultimately, I think one of the best practices, and I'm not talking about like a dental practice, but I'm talking about like an independent, like mental practice, thing that I kind of go by, is that understanding that you don't really know what's going on in that patient's mind. You don't necessarily know, you've never walked in their shoes. So before you make assumptions about, is it me, or take things personal, that you actually try to level with the person and figure out what's going on with them to make them feel that way. Sometimes, a lot of the time, it's just, miscommunication. So if you really, I would say, come out of yourself and really try to meet that person where they are, then generally that dissolves a lot of conflict. So, but again, we're human. It happens.
And Joel, just so I can reach the real question, he asked specific situations. We both dodged it completely. Yes, I had a guy driving around my practice one night. He wouldn't stop driving around the practice like he was going to just kill everybody in there. And I had to call the cops. So things happen. It's a good time, but
Was he a patient?
Yeah, he came in. He had a toothache really bad. Ended up, I treated the toothache that night. I actually worked him in and did a molar root canal therapy. The thing looked gorgeous. I would have submitted to the board myself, but at the end of the day, he got livid once he went back after his car and he noticed he had some white stuff on his face from the impressions. Stormed back in the building, just went absolutely AWOL on everybody. Kind of actually back into the corner. And I just told him he had to leave, and he just kept circling the building. And I was just like, just let's get the cops. Let's just do that. So there's a real answer for you.
That's Aspen Dental, the hard-hitting, weird stories. Ari, any patient stories you want to tell? I'm going to expand it now for you. A good success or a difficult patient.
So I have one from yesterday. So we'll call him Mr. E. So he came in to get, he only had like 3 root tips left over, and he just wanted some new dentures. So we did his surgery, but prior to that, he's on Plavix. And so his doctor, usually the rule of thumb is stop 7 days before, but we still wanted to get that medical clearance. And his doctor said, oh yeah, he's got to stop 7 days before. And our office manager actually scheduled him like 3 days out. So I told him, look, we have to move it. It's for your safety. So that was the first thing he was ticked off about. And then on top of that, one of the impressions that we took didn't come out well. So when we deliver his immediates, the upper denture wasn't biting down correctly. But, I told him, we'll fix it the next day. And he was okay with that. But then he came in and I guess like overnight, he just like worked himself up. He was really upset. And at this point I was busy, seeing my production, my new patients. And then my office manager went in there to talk to him, and he got so upset and he was so nasty to my dental assistant, my OM. So they told me, Dr. Choi, can you go talk to him? You're the only one who can talk to him. And I was like, okay. So I went in there and I listened, and he was telling me, look, so many things have gone wrong and blah, blah, blah. And I was like, look, Mr. E, let us fix this for you. We're going to go ahead and make you a good upper denture that fits right with the lower. Let's get this on track for you. And then everything else, I do apologize. And so he calmed down. And then he goes, let me talk to your dental assistant. I want to apologize to her. So I grabbed her and he apologized to her. He even hugged her. He hugged me. And we're all good. And today we actually had to order specific teeth because he changed the color. And I told him, look, Mr. E, it might not come in today, so we might not be able to do your wax try. So just keep that in mind. And lo and behold, today his teeth didn't come in, and our PSR had to call him, and he already had that expectation set up that the teeth weren't going to come in. And I told him the latest he'll get his teeth is on Monday. So he already knows that, and now he's happy. So setting that expectation up is very important.
Great, thank you. Here's a fun one, and I'm going to editorialize a little bit. The question is, anything you would have done more or less of in dental school? And I'm going to say drinking and other assorted recreational activities not included. Alex.
Yeah, no. Dental school for me, I went to a very high clinical school. So OU, Oklahoma is actually pretty well known for seeing a lot of stuff, really. So it's like, for real though, we did a lot. We did a lot of crown preps, we did a lot of root canals, we did a lot of full mouth extraction, we did a lot of stuff. So it's not like I came out, not equipped. But I think that I probably could have, paid more attention to certain techniques for, fillings and root canal therapy and stuff. I think that's for everybody. That's just me.
What about you, Kim? Anything you would have done more or less of?
I'm like, me.
Yeah.
There's plenty of things. I'm like, please ask me, because I feel like you don't really understand it until you really get into practice. But I think oftentimes maybe we pay attention a lot to the clinical, like the learning how to prep a crown, learning how to do a root canal, and you know, there's less time that's spent into the treatment planning piece. And I believe that was really important because obviously when you're seeing patients and they're coming to you because you're doctor such and such, and they're coming to you with an issue, and they want to know the order that it goes in, and they want to know, you know, certain things as far as the success rates. And, you know, you have to be able to base that on evidence-based things, not just because you saw your friend do it or that it's on Instagram or something. So I believe that paying attention to the evidence-based approach, really understanding and diving into treatment planning, I think that those would be two things that I had to pick up, you know, and I learned more of an appreciation for them as I was starting in my first, I would say, 3 to 5 years of practice.
Thank you. Ari, I guess you're sort of the most recent in dental school. Anything you wish you did more or less of?
I wish I did. Well, it's never less. I always want more. So I wish I did more surgical extractions, but now I'm so comfortable. I'm in autopilot mode now. From all the extractions I've been doing. My POP, Dr. Ali, actually taught me a lot, and Dr. Nunez as well, because I was with them for a little bit in Texarkana. I wish I did some veneers, and I wish I went on some service trips while I was in dental school.
Great, thank you. Back to patients for a second. So aside from those that drive around your practice, do patients stay with you or see you consistently throughout their treatment? Ari, you want to start with that one?
Yes, my patients do. I actually left for a little vacation like a couple weeks ago, and we had a temp doctor come in, and so a lot of the my front desk had to call my patients and tell them Dr. Choi's not going to be here. Do you want to move your appointment? Do you want to stay with her? And most of them did not want to be with the temp doc, so they had to move all my patients. So when I got back, I was very, very busy, but I love my patients and I try to be with them. And if they're cool with seeing another doctor while I'm not here, I'm cool with that too. But a lot of them are very emotionally attached to me and I love it.
So it's kind of like your hairdresser or your barber, like you're going to see them and nobody else. And it's a monogamous relationship.
Yes, that's the analogy I actually gave someone, one of my patients. I was like, it's like getting your hair done. Getting your teeth done is like getting your hair done. They're very important. They're on your head, you know? So yeah, you hit it on the spot, Joel.
Kim, anything to add on that regarding patient consistency with their doctor?
Yeah, we try to maintain consistency within our, comprehensive care, because obviously you'll do a treatment plan, and patients, like Dr. Choi said, they get attached. I mean, and so honestly, you want to see those patients. You want to be, in that outcome. You want to be there for the patient. So we try to keep it as consistent as possible. Some of the challenges, however, I think come with, when it comes to, say a patient is requesting a certain time or a certain day and things of that nature. But I believe, like Alex said, with full transparency and setting that expectation earlier, if we're not able to meet that patient's needs, scheduling wise, then we would definitely let them know.
Thank you. Alex, you want to add anything to that one?
Not really. They really nailed it. When it comes to seeing the same people, associates. The only thing I would add is that I tell my associates, the minute that I walk into a room and I try to take over treatment, and the patient wants to see an associate doctor that works for me versus me, you've done it. You've made me happy. You've made my day.
All right, well, maybe we can make somebody's day with this one. I graduated 4 years ago and I'm still an associate in my private practice. Am I too late to start a career at Aspen? Alex, is this person too late?
Absolutely not. Okay. So I grew up in family practice. Okay. I was literally the anti-DSO kid. My dad's had a private practice for 35 years. I knew exactly where I was going after dental school. I knew exactly what I had set up. a great $2 million practice, going to go over with my dad and brother. I practiced there for a whole year. I learned how to do implants. I had everything. And at that point I thought, am I too late to go to Aspen? Even at that moment, but I had to make a decision. At some point you just have to dig down and say, am I going to make a change? Am I going to make something happen in my life that's going to be big? It's going to change the events that are going to occur in the future. And I'm telling you, that was the best decision I ever made. And it was the hardest decision I ever made in my life, was leaving my family practice to come work at Aspen. And I started as a temporary doctor just to test the waters because I didn't understand. I didn't trust the system yet. But once I got here, it was just an unbelievable experience. I started to actually realize, that everything that I thought was truth was just not. And I found my own truths, and that was huge for me. So no, I think that anybody, however long you've been practicing, I've got partners who've been practicing for 10 years, that came in and partnered with me. My brother left the practice finally and came and partnered with me in Oklahoma. I've got doctors who've been practicing for 2+ years, and they are also my partners. So no, it's never too late to start.
Great, thank you. Ari or Kim, anything to add to that? Never too late. Thank you. All right, Ari, I'm going to assume you're on the same page with that. So here's one that I'll take.
Yes, absolutely.
So does Aspen Dental help pay for continuing education classes? So the short answer is yes. The medium answer is when COVID really sort of swept the world last winter, spring, we actually opened up our CE library to the public. And so grab a paper and a pen, jot this down, aspendentalce.com. It's an ADA CERP recognized library, hundreds of hours of CE in there, and it's free to any clinician in the country, aspendentalce.com. So there's that one. Thank you. So here's another one that I'll answer, but we'll see if our panelists want to add. Is Aspen Dental interested in managing my office? And so what's unique about Aspen Dental amongst all the dental support organizations, Aspen Dental only opens new practices. Aspen Dental does not acquire existing practices. So while we usually try to only say yes to questions, the answer to this particular question is no, because all of our practices are built brand new with the latest technology at the time. So that is that. All right, folks, the questions are pouring in here. I'm doing my best. Sorry, they're pouring in. Here's all right. We got a joker. How do you become such an exceptional moderator? You just got to keep working at it. That's a real question. I'm not making that up. How has Aspen helped providers during COVID, and how has Aspen acclimated their offices during COVID? Alex, why don't you start with that one?
Oh man, that's a broad question. I think every single office, obviously, we were led by an incredible management company, which is ADMI. Aspen Dental Management Incorporated did an incredible job for helping us identify where we could maybe limit our exposure, our safety, seeing as many patients as we could while still being profitable. They helped us through our PPP loans. They helped us through every single bit of this. So obviously, I have to give huge props to ADMI for that. But obviously, on a smaller end of that, there is this, the local things that are happening within each state. Obviously, we're nationwide, so every single story is probably just a little different. And I don't know that. I mean, I haven't spoke directly to Dr. Haynes, but I can tell you that in Oklahoma, we tried our best to keep things as functionally operating as we could, doing emergency care through that time. But we all came out in a pretty good way. I'd have to say, if it wasn't for those things that they put in place, I don't know if I would have been able to sustain. But we did really well, and I'm glad for that.
Thank you. Kim, how did you handle COVID? How have you been handling COVID?
Well, I mean, ultimately, I am extremely grateful for the support that I had during the PPP loan was huge. I mean, as far as being helped with that application and being walked through that process. And I say that because it was a very convoluted process overall. And it's scary. I mean, you have these offices, you're being told to shut down. You don't necessarily know what's next. So it was a very, very, I think, scary for anyone. But obviously, when you talk about, shutting down, having to handle, your business, the employees, furloughs, and literally, I mean, they held my hand through all of it. And, I'm grateful for that. So obviously I'm in Texas. So, I mean, we were one of the first states to open. So, our laws are a little bit different here, but, what ADMI helped myself and a lot of the other practice owners with was unbelievable.
Thank you. Dr. Choi?
My office has a lot of PPE, so it's great. And we're still socially distancing. We have signs up because, I'm in Texas as well, so we don't have to wear a mask, but we still require for our patients to. We have a mask sign on, and if our patients don't wear it, we kindly ask them, could you please put your mask on, just for the safety of everyone here, and they're okay with that. But we always take precaution just to be safe.
Thanks, Ari. This is a question that we've gotten before. It's a little bit difficult to answer unless somebody has experience in another organization. But the question is, how does Aspen Dental differ from other organizations like Delta Dental or Great Expressions? So does anybody have experience with any of those? No. Okay, so a bunch of head shakers. What I'll say on that is do your homework. Gather a list of your key questions and make sure you ask them at every opportunity that you have. I can speak to some of the differences within the organizations, like, for example, that Aspen doesn't acquire practices and that all practices are brand new. Also, all Aspen Dental practices are branded, whereas some of the other dental support organizations, they're not branded. So it could be Dr. Alex's office, and it's not necessarily clear that it's part of a DSO. Folks, there's advantages and disadvantages to both. You're going to get biased opinions from this crowd. We believe in what we do. That's an excellent question that you can follow up with if you request an interview. But no matter what you do, just ask the key questions that means the most to you so that you understand what those differences are.
Joel?
Yes.
The other thing I know that's really unique, at least I feel, about our organization is our practice ownership program. So I don't know if those programs are offered in some of the other DSOs. So I think that may be a difference. But other than that, I'm not necessarily sure.
Thank you, Kim. Anybody else want to add anything? Did I cover that reasonably well? Yeah, it was excellent coverage. Wow, thank you. Can an associate work towards ownership? If so, how does that work? Ari.
Yes. So the general rule of thumb is, you want to, some people start off as MCDs, but I honestly do not recommend that. You have to start off as an associate, in my opinion, just because, you can focus on dentistry, get your speed up, gain confidence, get kind of a framework of how everything works. And then once you feel like you're confident in that area, you can, learn how to manage a whole clinical team. And that's where you would have to make the big step before you decide to be a POP. Just because managing clinical director, that's a big leap from associate. You have more responsibilities. You have to be able to manage the whole clinic, even the front to back. It's very important. And then once you're confident in that and you can have an office that profits, then you can make that jump to practice ownership, because that will set you up for success when you want to get your practice. So I'm headed in that direction, hopefully. But yeah.
Great, thank you. And Kim, you own 3 practices in Texas, is that right?
Yes.
So could you tell us just a little bit about your path from associate to owner?
I was a bit different in the fact that I did right out of dental school. I did a residency out of Boston University, and then I went to practice in a community health center in Boston. And honestly, that was at that point what I believed my path was. I wanted to be in a community health setting, and I also wanted to teach. So I started teaching on the clinical floor, at Boston University. And then things changed, right? I was looking for a job. Unfortunately, the community health center that I was with started to go belly up. It was losing funding from the state, and I needed to find a new job. And I honestly wasn't looking for something that I thought was going to be long-term, because I had planned to move to Texas because that's where I'm from. And I actually started in Massachusetts, working in an office in Leominster, Massachusetts. I had a POP. I started off as an MCD, I think a little bit because of the previous experience at the community health center and things of that nature. And then after working in that office 2 years, I was interested in becoming a practice owner. We were opening offices in Texas, and here I am. So that was from 2011 to now. What are we in 2021? So that's kind of my Aspen story.
Thank you. Alex, your path to ownership.
So my path to ownership was actually pretty short. It was a short path. So I was in Oklahoma. It was a really untapped market. It was struggling, obviously, at the time. It was pretty new. A lot of times when we have new offices opening every few days, a lot of those practices just need time to mature. They need a consistent team. They need a great doctor. They need a great office management team. Some of those things just take a little time. But I came on as a temporary doctor, like I mentioned before. That was a temporary for probably 3 months before I just knew that this was it for me. I fell in love with the model. I fell in love with the mission. I fell in love with my staff. And I just immediately took over. I started as an associate dentist with about 2 months after coming off of the temporary title, went to associate 2 months, took over as MCD. My uncle was actually the residing MCD in the practice. He got very sick. He had to, take some time off. So I took over as the MCD. And then after about 6 months, I bought my first practice within the first year. And obviously, throughout the last 5 years, we've accumulated and bought the majority of the practices in Oklahoma. I've formed partnerships and relationships with many doctors. I currently have 6 partners in the state of Oklahoma, and we currently own and operate 11 of the 15 practices in Oklahoma currently.
Great. Thank you. Those are really amazing stories. And Ari, we're excited to see where your story takes you. And maybe in a year or two we'll have you on here and you could tell us what it was like when you opened your first practice. Some clinical questions coming in here. Would Aspen help with implant placement or CT scan readings if we already finished the implant courses? I don't know what that means. I'm not a clinician, folks. So if everybody seems to be making similar faces, so let's put it another way. Are we doing implants? Are we using the CT machines? And how's that been for you? Alex, go ahead.
Yeah, so all of my practices at this point, I believe, have CBCTs now installed or going to be installed in the next couple of months. We do obviously have the ability to send out for guided surgeries. The implant training program that was been developed by ADMI or Aspen Dental to help train doctors nationwide has really changed a lot over the last few years. It's getting a lot more focused, and it's really, really an impressive program. But it's getting doctors trained up so that they can actually place implants pretty quickly. I personally, before we had that program, I've been training doctors to place implants by sending them to some didactic courses, and then I'm going to basically be that mentor doctor or I'm going to set them up with one of the partners to have that side-by-side, hands-on working relationship where we can start placing implants in-house, and you've got somebody standing by helping you through your first placements.
Thanks. Kim, any comments on the use of implants and the scanners in your offices?
I mean, similar to what Alex said, I have CBCTs in all of my offices. We do guided surgery. Right now, currently, I'm the only dentist besides my oral surgeon that places the implants in the office. They are going through implant training. One of the things that I think is truly important before placing implants is being real comfortable in surgery. So you want to make sure you really know bone, you really feel comfortable with surgery and things of that nature. I think sometimes implants are the crown jewel of dentistry, but one of the important things about it is, anything you do, you own it. You own that implant. It's in that patient's head. There's a lot of liability that comes with it. So the training courses that ADMI has, it's a really measured course to make sure that you're ready to go through it. I don't want to paint the picture that it's just like, we have this program, we're starting dentists, and we're just rushing them out to go place implants. No, there are certain things that a dentist has to do in order to be, I would say, selected for that training. So they have to have done a certain amount of surgeries. They've had to, do a certain amount of bone grafts and membranes. And that, they also would have worked with like a mentor doctor like Alex, or myself. So before, they go from 0 to 100, there are some checks and balances that are in these programs that ADMI has to make sure that doctors not only are comfortable doing it, but are proficient in some of the other things that you need to be proficient at before we send you to a program to place implants.
Thank you. A similar question. What instruments do you use, and does Aspen require you to use particular instruments? Ari?
No, they don't. I mean, the office comes with certain instruments, but we have our own supply catalog and we can order whatever we want. We have a huge book and we actually get discounted supplies on everything. It's amazing. We'll go in there and I'll tell my lead DA, I want this. I want this syringe. It's the gold one because I don't like the regular one. It's kind of crappy. So I'm pretty diva with my instruments, and even with my like extraction forceps, I want like the ergonomically like sound one. So she'll go ahead and place it for me. But yeah, there's no, I mean, whatever works for you, as long as you get the job done, get whatever instrument you want.
Now, Alex, you're known far and wide as a diva. Do you want to comment on your instrument usage?
So I have my specifics, but I'm traveling so much now. It drives me nuts. I go into a practice. It's just different stuff everywhere now. So I'm just trying to get used to it, just being able to kind of change and adapt on the spot. But I tell every single one of my partners, all my MCDs, all my associate doctors, you need to get that works in your hands. I'm not here to tell you what is going to work in your hands. I want you to spend the money. If it's a little money that's going to get you where we need. If you need an isolite, let's get you an isolite. If you need a laser, let's get you a laser, right? Like the little things, like we're not going to worry about that. We're going to worry about you having the tools you need to help the patients, period.
Thanks, Docs. So, folks, one of the advantages of the Aspen Dental Network is our size. And Ari alluded to this before, but we are a very large client of companies like Henry Schein, and as a result, we benefit from bulk purchases that we'll make. So we are able to acquire almost any equipment at a very attractive rate. But if you want to use any instrument, I imagine if you wanted to use a shoehorn, you could use a shoehorn. Please don't use it on me when I come in. But folks are, of course, entitled to use whatever they'd like. So this question is for Alex and Kim. We'll start with you, Kim. To those of you that own multiple practices, how much time do you spend in each practice over the course of a year?
Over the, I apologize, but I have to take that question and make it a little bit smaller in as far as the scope of the question. I believe it has changed depending on what the demands of the practice have been. So because I do work with doctors that do require mentorship, and I do spend different times in the offices. So for my College Station office, that's about 2 hours from my house. There was a point that I was there like 3 to 4 times a week, a week. So, but right now I'm currently only going to that office one day a week, and I am spending more time in my Colleen practice. So that's why I said, I believe it would depend on what exactly is going on in the office, and what exactly I'm trying to work on with my doctors, and what patients are in the office at that time that will dictate my schedule. But I think the important thing is to say that it's very much patient-based and doctor attentive. So it changes, I guess, is the best way to answer that.
Thanks, Kim. Alex?
Yeah, I think that that's a fantastic question. I think that it's going to differ. And like Kim was talking about, every single practice is going to be different. Every single doctor is going to be different. And what I need to do and how often I need to be there is going to be different. There's a lot of my docs. Remember, I have 6 partners. I got a lot of MCDs. I got a lot of associates. Like, a lot of them don't want me in their practices anymore, okay? Because, every time I clock in, guys, let's be real here, okay? You're paid, and your bonus is based on your controllable expenses. If I come into your practice, I clock in, guess what? Your bonus just went down. So, they know that. And it's not to say that that's, the whole end goal. But, I mean, at the end of the day, like Kim said, if I need to spend some adequate time with development, if I need to mentor, if I need to teach, if I need to go in and knock out a crap load of production, I'll do it. If they can throw $10,000, $20,000 on a day, then I'm going to go in there and knock the crap out of it, right? That's the whole point. And that's what I'm here to help them with. So I think it's definitely location specific for sure.
And Alex, crap load is a dental term they taught you in school?
100%, yes.
You got a crap load of knowledge there. Very good. Thank you. Same question. Thank you. So, Kim, this is a question that somebody is aiming specifically for you. I'm a third-year BU dental student and was just wondering what your thoughts are on how prepared you felt coming out of BU. What did you feel confident about, and what did you still feel like you had to grow on?
Awesome, Terriers. That's right. BU in the house. Coming out, the reason why I decided to go to an AEGD was because, one, like I spoke before, I thought I needed more training in treatment planning. That was really important to me. Endo was really important to me. Just having more, I just needed to do more endo. Felt pretty comfortable with surgery coming out and restorative. Crown and bridge was an area that I felt pretty confident in. But I believe the treatment planning and the evidence-based treatment planning approach was really important, that I felt like I wanted to master, or I wouldn't say master, but wanted to get more comfortable with. And then also endo. But BU also, I mean, honestly, it's a really good school. They do really, really well, when it comes to board and licensure. So it's an awesome school. I'm just going to leave it there.
Ari, do you want to answer similarly about your dental school experience? Just for fun, to give a shout out?
Tufts. Yeah, so for Tufts, I wish that I learned how to do surgical extractions more. I know you're a competition, but I have a lot of BU friends, so I love Boston Terriers. So yeah, I feel like licensure-wise, Tufts did prepare us really well, but we have a lot of residency programs, and we're a very established school, so a lot of the complex cases we didn't really get to do. It was very basic, like, fillings, obviously, crowns. I really wanted to do veneers, didn't get a chance to do that. And then full mouth extraction, which I did in school, but I mean, one of my very first cases was a full mouth extraction case when I was in dental school. So that was very scary. And I just saw blood everywhere. And so I had to get a resident to come, and he pretty much did the whole thing for me. But now I do full mouth extractions all the time. But I feel like Tufts prepared me well, like baseline. But coming to Aspen really helped me a lot in terms of getting the mentorship I needed. But yeah, I love Tufts. I wouldn't be a dentist if I didn't go there.
Alex, where did you go to school, and do you feel they prepared you properly?
I went to Oklahoma University, and they definitely prepared me well. They are probably the best clinical school in the whole nation. We don't have a lot of these residency programs you guys talk about because we're doing it ourselves, okay? So we're really cool.
Tell us what you really think. I got to give a shout out to my alma mater. I did my doctorate at UNE, the University of New England, relatively new on the dental scene, but a shout out for whoever our mascot is. Woo! Go them. Lobster rolls, maybe. They're in Maine, if you didn't get that joke. Folks, we've got about 15 minutes left. Clearly, we won't be able to get to all of the questions, but please keep them coming. And when you submit, you can include your name, and we can get back to you with that. Remember, I encourage you to request an interview. It's probably your best way to get those questions answered. You'll wind up interviewing with a practice owner, so you'll get an opportunity there. Let's see here. Okay, here's a fun one. Favorite and least favorite part about working for Aspen? Alex. I'm sorry, I got to be clear.
This is a totally loaded question. I don't like that one at all.
Well, that's
all
why.
Right, so my favorite part of working for Aspen. The truth is that as a practice owner, being able to rely on my operations team and just give all that away, like I don't have to worry about payroll. I don't have to worry about the bills. Like all that crap gets paid and done. Like they do it. Yes, it comes out of my business, but they take care of it, which is awesome. So that's definitely my favorite part. What's my least favorite part of working at Aspen? See, that's the loaded part. I know it. When we order supplies, it can be challenging, guys, because we, obviously we're ordering through specific ways, and then we have to be confined to this specific type of ordering system, not like what we can order, but like a system. And sometimes systems can make things, but it's still fast and it's still good and it still works. It's just like for me, sometimes I just want to I find a really cool tool and I want to order it, but then I'm like, no, you can't order that because it's some weird off-brand crap. And then I have to contact somebody through our systems and get it done. So that's my truth answer.
Well, we appreciate the truth. Ari, favorite and least favorite?
My favorite is all the people, my patients, and of course my team. And anytime we are short staffed, we can always, call another Aspen office and they can lend us a DA. And I don't know, it's great. If there's any issue, we just call Practice Support Center and they'll fix it for us. So we can focus on our patients and dentistry. It's just amazing. And then my least favorite, I would say I wish we had a Serec machine. I think that would put us on edge because we do have some patients that come in and they're like, can I get my crown today? And I'm like, you can get your 10th crown today. So I wish we did have that.
Thank you. Kim, favorite and least favorite? Kim is either staying perfectly still or she's frozen.
It's impressive.
That's impressive. Wow. All right. I'm going to assume Kim's frozen and not staying perfectly still, although maybe she's thinking real hard. Folks, just to clarify, the question was favorite and least favorite part about working for Aspen. I work for Aspen Dental Management. That's the dental support organization. Dr. Alex works for Dr. Alex because he's the practice owner. And Dr. Choi, Ari, works for Dr. Ali, who owns the practice where she is currently MCD. So there is a bit of a distinction there. Those of us on the support side work for Aspen Dental Management. Those on the practice side either own their practices or are employees of the practice owners. And I'm sure the question wasn't directly posed to me, but I will answer my favorite and least favorite part. My favorite part is being able to help the people who help our patients. And that's just an incredible feeling for someone like me that wanted to do good in the world. And I am a close business partner and colleague of folks like Dr. Alex and Dr. Ari. And so that brings me joy. And my least favorite part, and yes, I'm doing this on purpose to roll immediately into the next question. My least favorite part is having to fight some of the incorrect perceptions or misperceptions that are associated with a DSO. And that is a little bit of a struggle, which amazingly leads perfectly into the next question. We call these Ask Me Anythings. There's no question that's off limits. Why are there negative comments about Aspen Dental on Indeed.com? And would you care to address some of the reputation concerns that we hear sometimes? Ari.
What kind of reviews are on Indeed.com?
Why don't you go ahead and Google it?
Is it like patients or people who work for Aspen? Like, I wanted to know.
Indeed is in fact a job board, but the floor is yours. If you would like to address the reputation issues that sometimes come up regarding Aspen Dental, now's your chance.
Oh, okay. So a lot of times people think we're just money driven and we don't care about our patients. I really think that's a very subjective answer. I mean, I'm sure, there's people out there who are money driven, but all the doctors I've worked with, they genuinely care about people. So I don't like it when people say, oh, all they want to do is make money. And I will see some reviews like on Google from patients, and they're just trying to make money off of us. But the thing is, it's comprehensive treatment planning. So I always emphasize that with all of my patients. And I haven't had any negative reviews yet about being overcharged about anything in terms of overtreating, because it is a full exam. So I think it's the expectation factor if you tell your patient that, but obviously there'll be patients that you can't always, make happy. They'll come in with already a negative attitude. And then also in terms of working for just the DSO in general, that, you're just going to be thrown into the pit and you're not going to learn anything. You're just there to just do the work. That's not true either. So yeah, I mean, I love Aspen, and whoever has that stigma should come talk to me or one of us, and we will set them straight.
Thanks, Ari. Alex, do you want to address reputation concerns?
Yeah, I mean, obviously, I've gotten on Indeed, and I've read, Facebook reviews, and I've read Google reviews, and all that good stuff. And yeah, there's two folds. I mean, obviously, there's the employee piece, and then there's obviously the patient piece. As far as to make it simple, we're an easy target, right? We are the only nationally recognized branded dental practice, so it does make it very easy to kind of point fingers, because when you point at one of us, you point at all of us, right? And again, you mentioned that earlier, Joel. You had talked about how that is our biggest blessing and it's our biggest curse, right? Those things it's huge because we have these relationships with each other. We're branded. We believe in the same mission, the same goals, the same values, and we uphold those across the nation. And, it's my job as a practice owner to represent that. And obviously, whenever I bring in doctors or employees into that business model, there are certain levels of, of expectations that I have for my patients, or my care for my patients that I expect out of my employees. And so when they leave, or if they leave disgruntled, it could be for 1,000 reasons, but it may just be that they didn't fit the model. Maybe they just didn't believe the same things that we believe. And that can create that kind of frustration. Maybe they didn't get the promotion that they wanted. You can dive into this as deep as you want, but at the end of the day, it really is about the patients. And, the other piece of that is everybody talks about like hygiene. Well, my biggest challenge for everybody out there is, you know, when we talk about hygiene, you know, that's the foundation of our oral health, you know. And so people talk about over treatment planning and all this stuff that they think happens. You know, my brother was also on that train, and so was I before I got here. And my only recommendation to any single person who has those concerns or fears, there is not a practice owner out there in this nation within Aspen that wouldn't let you come and observe and listen to every single new patient treatment plan and decide on your own behalf if you think that we are over treatment planning our patients. And come on, fly in. I see in some of my practices, I'll see 6 to 10 new patients every single day. All it takes is one day. Trust me, you'll see it, and you'll see plenty of it.
Great answers. Thank you. Thank you very much. Welcome back, Kim. You missed it. It was incredible. It was incredible.
I mean, honestly, I was like, what is this big brother? No one wants to hear my like good and bad.
Well, we'll cue you. Do you want to share your good and bad? You can if you want.
Shortly. I mean, just keeping it short. I mean, obviously, I appreciate as a mother of 2 beautiful babies, the support that I get. That's amazing because, I mean, for some odd reason, people say that, you know, we have to do it by ourselves and there's no, like, it's the grit of, you know, doing this and doing that. And that's this whole big, you know, mantra of what we feed ourselves, right? And at some point, you have to be able to say, you know what, I didn't learn this in dental school. I don't really know how to approach it, and it's okay. And I really do need that help and support. That would be the reason I think it's awesome. The reason it's not so great sometimes is like I sometimes as a dentist feel like I have to defend myself by saying that I am associated with the DSO. You know, so some of the time, you know, well, why are you with Aspen? What, you know, because people don't know the good that we do. So I believe some of the time, the difficult part of being with ADMI is some of the times people don't know the awesome patients we see, the great work that we do, and they put a stigma to the work that comes out of our practices. And I know exceptional owners, I know exceptional work I know the work that I do. So that would be the thing that the negative. That's it. And I said it. Now my computer's probably going to go black again.
We have just a few minutes left. I'm going to put up a fairly easy one, and then I'll give you guys a chance to give us your last word here. This question just came in. Does Aspen office provide clear aligners? So, Alex.
Yes, we do. Simple answer. It's short and sweet, but the truth is that, you know, we work with clear aligner systems right now. We started off with iTero, using iTeros in our practices. A lot of our practices have that. So we were offering Invisalign. Obviously, you probably have seen a lot of the news and talking about the relationships that we're creating. And Trios is coming in and 3Shape and all that good stuff. And I'm really excited about the new options out there. Obviously, we learn a lot. Dr. Galante is somebody who supports our practices, and she's an incredible orthodontist and is just a book full of knowledge. So it's a fantastic thing to be able to provide for our patients.
Thank you. So we're going to end with story time, and I want to be mindful of the clock, so let's make it quick story time. Kim, we'll start with you. What was the moment where you said, I think this is where I want my career to be?
I would say that it was, you know, it wasn't like an instant. It was something that gradually happened over time. I believe it was the patient that we market to, and the consistent patient in the office has always resonated with me. So because of that, I like the patients that I see every day. So that's the reason why I decided to stay with Aspen Dental. I've been with them since 2011. And, you know, it's been a good way.
Thank you. Ari, same question. What was the moment where you thought, I can see myself here?
Can you repeat the question? I'm like breaking in and out.
Sure. So the question was, what was the moment when you said, I could really see myself making my career here?
Oh, that was when